Hello, and welcome to Like It Is. I'm Deja Gilmore. Today, we are discussing Philly's latest attempt to battle its opioid epidemic, safe injection sites. Proponents of these sites believe the facilities will save lives, improve drug-infested areas, and act as a stepping stone towards treatment for addicts. While those opposed believe the sites will only enable addicts and increase unwanted drug activity in the areas, with the help of a panel of experts, we hash out the nuts and bolts, the legalities, and the benefits to the community from this controversial program. We're telling it like it is.
Talk about it.
What we see around us, we don't believe that because we want to buy into standards.
Talk about it.
We have to prove that we're good fathers. When, as far as the mothers, it's just assumed.
Talk about it.
So I'll wait on the check. I'll keep myself a separate.
Talk about it.
I'm a black man trying to save a black man, and I noticed as I looked around the whole room, there's no one helping me.
Talk about it.
Reality is, if it affects you, it affects me.
Talk about it.
Lending their expertise to the conversation is Christina Garces, a medical student at Temple University and co-founder of the Soul Collective, and David T. Jones, commissioner and co-chair of the Mayor's Task Force to combat the opioid epidemic. Thank you so much for joining me today.
Thank you for having us.
All right, so let's begin with an explanation of exactly how safe injection sites work and what led to the decision to implement this program.
Okay, so let me begin with, as you mentioned, Deja, that the mayor convened a task force, and that task force actually generated 18 recommendations under 4 overarching strategies. It was prevention and education, treatment, overdose prevention, and then criminal justice involvement. And it's important to note that those 18 recommendations, the comprehensive user engagement site, and that's what we're referring to it as, again, the comprehensive user engagement site, is the 13th of 18th. And so it really is a comprehensive plan to combat the opioid epidemic. Comprehensive user engagement sites really are established, and it's also important to recognize that we're talking about developing these in part in response to the large number of overdose deaths that have occurred, right? So we had probably over 700 overdose deaths in 2015, over 900 in 2016, and then over 1,200 in 2017. And so the idea was to say, let's figure out, again, a strategy amongst many that will help keep folks alive long enough to get them into treatment, right? So the comprehensive user engagement site would be a place where people would be able to go, they would be able to use illicit drugs, and they would use those illicit drugs under the supervision of medical, clinical, and probably people with lived experience, again, to be able to give them some support and more engage them in a dialogue and a process that eventually hopefully would lead to them making the decision to go into treatment.
Where will these sites be located? Will it be multiple sites or just one general site?
Yeah, so we are in the planning stages. There's yet to be a decision about where exactly they will be located. What the research has demonstrated, so there are over 100, they will refer to them as supervised injection sites, internationally. There aren't any that exist in the United States. And what we found is, in fact, that those sites. I think it's important to be clear that those sites, there have been no one who's actually ever overdosed in those sites. Going back to your specific question, we haven't determined where they will be actually located, but in those sites, again, 100 internationally, what they've done is located them closest to the vicinities or the communities where people are in fact injecting.
Okay. And is Philadelphia one of the first ones that will be located in the United States?
Well, so I think there are a number of cities that I think that are under consideration: Seattle, New York, Baltimore, Philadelphia, as you just mentioned, we are. And so I think all are making a decision around, how they'll bring it up. And so it's, again, it hasn't been established exactly where and what the time frame is, but it clearly is among the strategies that we're considering.
All right, we do have a question from the audience. Please tell me your name and where you're from.
My name is Summer. I'm from Washington, D.C. I was wondering, do you require the users to do anything like a NA meeting afterwards?
No, the function of a safe injection site is specifically to allow people to practice and to engage in using in a safest way possible. I think part of the reason that safe injection sites have been shown to really work and queues have been shown to really work is they meet people where they're at, and there's not pressure to do any specific thing. I think a lot of people who are engaged in active use and chaotic use are constantly getting messages that if they don't quit, if they don't do this, if they don't do that, if they relapse again, they're bad people and they're failures and all that stuff. So one of the great successes of safe consumption sites is that it creates a space where it's very much like, we accept you where you're at, whatever you need to be safe, we're gonna meet you there, and then when you're ready, you can come to us. And when you're ready, you can do detox. And when you're ready, we can get you set up with housing. With that said, if you look at Insight statistics, 47% of people who regularly attend Insight end up getting into addiction treatment of some kind. And 23% of those people who do end up getting into addiction services stay in recovery, which is a very, very high percentage because a lot of people relapse, right?
Yeah.
And I think a lot of that success, the fact that almost half of people who attend places like Insight, and to be clear, Insight is the first safe consumption site in North America. It's in Vancouver, Canada. I think that a huge part of that success has to do with the fact that you are creating this space where you're building trust, you're building relationships, you're building a space where people are accepted where they're at, and then they can take this really big step, which is to go into detox.
Okay, thank you.
So when will the plan obviously is to get these sites up and operational. When will they be operational? Is there a proposed date?
So at this point, we actually don't have a solid date. I mean, we have generally we're thinking somewhere between 6 and 18 months. And again, it would be a private entity that would operate it. And so some of that, obviously, that decision making would be theirs to make.
Absolutely. So I understand when this program initiative came up, why wasn't it put in the decision to vote for these sites to go up?
So a couple things. One, I think that there was a pretty significant push to have to hear the community voice prior to even convening the task force. There had been community forums that happened, and then post the task force, there were 8 or 9 community forums that happened where we really went out to the community to hear their voice. Obviously, there were people who were very supportive of the idea of a comprehensive user engagement site. There were others who were less supportive. I think that at the end of the day, this really is a health issue. And like most health issues, I think the idea is to figure out what's the gold standard treatment and have that be kind of what leads it as opposed to making it a political issue.
And you mentioned that they're privately funded. So where will the money come from to fund this site?
Yeah. So the thought is that there will be whether there's foundations or just again private funders who will step up. I mean, this issue really is an issue that goes across socioeconomic status, and so there are people who, again, that have considerable means and resources that were impacted by this disease, and so we are very much hopeful that some of those individuals or entities will step up.
Can I add something really quickly though? So the other thing though is to realize, right, the opioid overdose epidemic is over when we want it to be over, right? So these sites can be done when we decide as a state and as a city and as a country that this is something that needs to happen, right? In the HIV/AIDS epidemic, At the height of that epidemic, we had over 800 people dying, and we decided, as several cities, that safe syringe exchange programs were what needed to happen to stem the new infections that were happening every single year. And we made that decision. As Philadelphia made that decision, New York made that decision, and the new infections of HIV like plummeted. It was done, and it was like literally the same conversation we're having now. You can't enable people to use drugs. You can't give people clean needles because then you're condoning drug use and all of that stuff. But that's the same argument it was happening now. It's the same argument that's happening with safe consumption sites, and when it opens is when we're ready to have it open, and when we as a city are like, we don't want thousands of people dying unnecessarily anymore. Addiction is a very, very complicated medical health problem. Overdose actually isn't. Overdose is actually really, really simple. You take naloxone and you spray it up someone's nose, and sometimes you need more than one hit, sometimes you need two, sometimes you need three, especially with fentanyl, but it's actually pretty straightforward. And in terms of the city like not giving money, I mean, there's money. Like the budget is for your department is $1.6 billion or something like that, right? So there is money there, but we have to make those decisions. Different cities are doing it in different ways. If Philadelphia wants to do it privately, then it's going to be a lot harder and more people are going to die in the process. There's other cities that are not doing that. There's other cities whose governments are putting down and throwing down for this to make this thing happen because they realize that thousands and thousands of people are dying and they shouldn't have to be. And if it's a public health issue, then the public health department should be involved in making that happen.
So,
And tell me what your name is and where you're from.
My name is Francine Elizabeth Natal. My question would be, are the drugs supplied by the personnel in the safe injection sites, or are the users bringing the drugs in?
there will be no drugs supplied. Individuals will bring in their own drugs,
Okay.
but there will be no drugs supplied, nor will there be drugs shared between individuals in the facility.
Okay. And the next question is, in reference to location, when you say Philadelphia, are you referring to the greater Northeast Philadelphia as well as North Philadelphia and the urban sections of the city?
Yeah. So again, from our perspective at this point, there's not been a decision made about where the comprehensive user engagement sites, the queues, will be located. Again, research has indicated that it makes the most sense to put those in close proximity to where there is most injection occurring. So that likely would be. And I also wanted to go back to something Christina said. Just in terms of, I think that the opportunity for the public-private partnership is a critical one. I think that the way we're approaching this in terms of saying that we'll continue to pay for the treatment component of substance use disorder, I think is critical because there is a way for that to be continued through with Medicaid and other kind of payment funding options. But I also would say that it's important to know that the private sector, the benefit of that partnership is they actually are able to move a little quicker and be a little bit more agile, which is why I think the partnership would work. I think at this point, again, there really aren't other in the United States. Actually, have not been any other places that have brought up a supervised injection site yet, and I think that that we really are trying to figure out again how to do this in the most efficient way.
Although that is, I just wanted to really note really quickly, there is a safe consumption site operational in the United States. It's underground, people don't know where it is, but it's being heavily researched and heavily monitored right now, and it's had great success. There have been no deaths. They're collecting data, information on it right now. So this is happening in the States, to be clear.
But not above ground. Just to be, so
I guess it depends on how you, right? Like if it's being researched, then it is to a certain extent being monitored and regulated as a safe consumption site would be.
And I think that's a beautiful thing. Just to be clear though, that it's just as far as we know that there aren't any that have been recognized at this point. Where Kristen and I completely agree is that it certainly the research has demonstrated that it does not increase volume in communities. That in fact it does decrease public discord, other issues around kind of public health challenges, for example, syringes being strewn around kind of in a community. You see a decrease there. I think that our data actually has demonstrated that there's probably even fewer in terms of people from outside of Philadelphia using that. It probably is at the highest in maybe 10%. So again, the vast majority of folks we're talking about is more like 90% of Philadelphians, and clearly that's who would be the primary audience in terms of treatment.
My question for you is, how does the use of these sites encourage more drug use, or as opposed to recovery?
So again, I think the research has really demonstrated, and this is the statistic that Christina just mentioned around the idea that so when people come into the comprehensive user engagement sites, particularly the one we had an opportunity to go to Insight in Vancouver, 46% of those individuals then went on to treatment. Part of what really happens is that it's an opportunity each time they come in to engage them, to talk about the idea about how a treatment can be effective, but doing so in a way where it's really kind of a very much a harm reduction approach. And so the goal would be, and as we talk about 46%, clearly that's nearly half the people then coming in that then go on into treatment. And so there's been no evidence that it results in increased drug utilization. In fact, again, what it does say is that there are more likely that you'll get people once engaged to start participating in treatment.
I do have another question from the audience.
My name is Ko, and I live in the Kensington neighborhood of Philadelphia that is overwhelmingly influenced and affected by the opioid epidemic. As a resident who has seen several people overdose on the street, who has the neighborhood kiddos coming over for reading club, stepping over used syringes, I understand the urgency and the necessity and the essential nature of these sites, but not everyone does. And I want to hear, what are those concerns, and more importantly, what is your response to those?
Good question.
Sure. So I think the number one concern we get is like, won't this increase drug use? Won't this increase trafficking? Won't this increase people coming into our neighborhoods and using drugs? And wouldn't this condone drug use? And as I mentioned already, like, there is no evidence that supports that happens at all. In fact, all of the evidence is on the contrary, that this doesn't affect crime rates at all. In some cases, it decreases them, and it really does help people get into treatment. Another concern that we hear all the time from community members is, I shouldn't have to see this. My kids shouldn't have to see this on their way to school. I shouldn't have to see people nodding out. My kids shouldn't have to walk over dirty needles on the way to get to school. And that's true. You know, the bridge that is most heavily looked at, Kensington Bridge, is like across the street from a school, and that is really frustrating, and that shouldn't be happening. But the reality is, and it seems like it's really counterintuitive for some people, but the reality is that these sites, keep people out of the sight of children, right? Because you're going into a clinic to do this behavior that should be kept out of the sight of kids. And like, when, you know, I wanted to talk a little bit more about like what the flow through a safe consumption site is because you go in, you bring your drugs that you purchase, you go, you get a clean needle from a nurse, you get all the supplies you need, then you go into a stall, you use with that clean needle, you immediately deposit it into a box, and then you leave. So that needle never gets on the floor. Right? That needle never ends up on the street because you have a safe space where you're getting a clean needle and you're putting it right into a box, and then you leave. Like, that opportunity to continuously create, you know, litter that kids have to walk over and, you know, inject in front of children have to see it. That never happens. That whole issue is just stemmed.
And we definitely want to follow up on that.
Yeah,
in terms
that's
of the flow
great.
through an injection site.
I'd be happy to do
what
that.
People can expect. But we're going to take a break. Are opioid users subject to the same legal ramifications as dealers and addicts of using other types of drugs? When Like It Is returns. Welcome back. We have a guest from the audience asking a question. Your name?
My name is Sterling Johnson. I am with Soul Collective.
You actually wrote an article about the lack of inclusiveness of the Philadelphia Safe Injection sites. Could you share your observations and then give us any questions or concerns you may have?
Yes. And I have a comment/question. In general, safe injection sites seem to focus on intravenous drug use. We know that the opioid epidemic affects majority The majority of people that are overdosing are white people. It's very important to understand the context of drug policy in the United States. It has affected people of color, black and brown people, more than anyone else. We have been the ones that have been criminalized. Our houses have been taken away, our families have been broken up. We need to understand that when we're talking about changing the way we do drug policy. And I want to know how a safe injection site will be taking this into account. And that majority, that black and brown people often use crack, cocaine. There are things that we need to take into account when it comes to the way that other communities use drugs, not just heroin and fentanyl. I would like to know both your perspectives on how a safe injection site accused would take these facts into account.
Yeah, so let me begin with saying I think that historically, the way we have approached as America has approached the drug epidemic has really been to try to arrest our way out. And as the individual who just asked the question indicated, I think that the way we responded, particularly to the crack epidemic, was in fact absolutely the wrong response. It had a dramatic and significant impact, particularly on black and brown folks. And so I think what we recognize is that we need to certainly take a different strategy as we move forward. I think that the Qs represents just that as one strategy, as opposed to, again, trying to arrest and recognizing the collateral damage that that would have on not only families but communities, that this is a way of saying if we can get folks to come in, participate in treatment, then in fact it doesn't result in them being arrested, taking away from their family, and in fact having the financial devastation that comes from having somebody incarcerated and not being able to be, whether they're a primary breadwinner or a breadwinner. And so that has really been, I think that is something that is in part in consideration. We also realize that when you look at those deaths, when I talked earlier about, over 700 deaths in 2015, over 900 in 2016, over 1,200 in 2017, that a third of those in each of the years represented people of African American descent and Latino descent. So the reality is that even though we're talking about opioids, it is still killing black and brown people. And so we want to make sure, again, that we are not making past mistakes and, again, trying to arrest, but in fact, helping people get on a pathway to treatment.
Now, I want to definitely get into the legal ramifications.
I feel like there's a big point that I think Sterling is asking about that I think really does need to get addressed too, and that's about what about other drugs, right? Because, you're absolutely right, that, this is not a white problem. That narrative is definitely a false narrative. There is a majority of the population of people who are using heroin and overdosing on heroin are white, but there's a significant population of people of color. Certainly Philadelphia, that is more than clear, if any city in the country, that Latinos and black people are absolutely being affected and dying because of this epidemic. However, we are now at a place in the opioid epidemic where it's spilling over to other drugs, right? So fentanyl is now being cut into cocaine. And I should back up a second and say, so death due to drug overdose is now the #1 killer of American people under the age of 55 across all ethnic groups, right? 6 out of the top 10 drugs that people are dying due to overdose from are opioids. But the #2 drug that people are dying due to drug overdose deaths is cocaine. And that of the number of the population of people who are dying due to cocaine overdose, that is a majority Black American population. And that has been steadily increasing for the last 5, 6, 7 years. And there's a spike going on very, very recently because fentanyl is now being cut into that cocaine too. So the opioid overdose epidemic is not just about heroin anymore. It's also about cocaine. And we are talking about 2 different drugs, and these 2 different drugs do have population demographics that are slightly different, but across the board, ethnic groups are being, dying the same. And the number 2 killer due to overdose deaths is cocaine. And so like to have a safe consumption site where we only accommodate people who are IV drug users, I do think is again somewhat unethical to accommodate people who are dying from this one specific drug. And it is a little frustrating for communities of color, Latinos and Black Americans alike, who watched the crack epidemic and got treated one way, and now this is a white problem, so it's being treated a different way. If we're going to re-replicate that bias and not accommodate people who are ODing due to cocaine, I think that is also doing a disservice to our communities. And like this isn't something that is not comparable. Like this is part of the opioid epidemic because fentanyl is an opioid. It's being cut into heroin and cocaine at this point.
And Sterling, you had any follow-up question?
Yes. To follow up on that, what are we going to do to make sure our health system understands that people experience addiction? Currently, it is a crime to have mental illness. It is a crime to have an addiction. It is to be a person with a substance use disorder. We know that there are places in the world where you can smoke, that you can smoke within a tent, where people are allowed to have access to services, and that is not what I'm hearing. And I want to know how we're going to build a system so we don't go back to criminalizing Black and brown people. Right now, we're at this great place where there's a narrative about white people that have gotten addicted to some pills, and it creates this innocence that is allowed to go on, and we can really attack it based on that. But we need to build a system that makes sure that not one more Black or brown person is put into jail because they have a substance use disorder. That's what I want. So, thank you.
Yeah. So I think it's, again, certainly another great question. I think the reality is that we know that 1 in 5 individuals experience symptoms that result in a diagnosable mental health disorder. We completely agree that we want to have a system, and I think that a system that is robust. So we're not just talking about, although the emphasis here is really around substance use disorder, opioid use disorder, and safe injection sites and supervised injection sites. What we really should be talking about more broadly is co-occurring. So the fact that if a person has a mental illness and addictions, recognizing that both mental illness and addictions are diseases, and we need to make sure that our system, and I think that the system in Philadelphia actually is a pretty comprehensive system in such a way that we are able to treat people and have them have access to outpatient, to intensive outpatients, to acute inpatient, to residential, so that you really have a robust array of behavioral health services and supports. I think the other piece, the other component of this, and then I'll speak to the racial issue. The other component of this is that we also really recognize that having people with lived experience be a part of the kind of treatment array and services and support is critical. There have been certified peer specialists, certified recovery specialists. We work very closely with here in Philadelphia with PROACT, with Prevention Point, with mental health partnerships to make sure that folks with lived experiences are getting trained and are able to be a part of that array. And the other piece, just in terms of as it pertains to the race, really is the stigma that continues to be pervasive. And so I think the more that we use interventions, for example, to address the overall stigma. So for example, one of the things that the department does is we really roll out mental health first aid. And that really is around educating community, giving the community tools to recognize the signs and symptoms of somebody experiencing psychiatric distress, so that they are able to then not only shy away, but actually be more comfortable intervening and helping direct that person to get connected to the supports they need. So I think it's that kind of array and that level of service and that robust continuum that we really need in order to be able to address this issue more globally.
Okay. And we have another question from the audience. State your name and where you're from, sir.
My name is Samuel Natel, and I was born and raised here in Philadelphia and North Philly, and in the Kensington area. My question will probably be a little bit of mixed emotions. Like I say, I was born and raised in Kensington. I have family there. And I see what goes on underneath the L. and underneath the Front Street, where they have all these man-made tents. And I see what's going on. And I have a little bit of mixed emotion about the program that you're trying to put in place. To me, and a lot of people that I've talked to about this have mixed emotions, because I'm not sure if this is a good idea, because it's sending mixed emotions to a drug dealer can turn around and say, I can sell you drugs, which is illegal. We all knew that. We all know about the drug trafficking that's going on in Philadelphia. And I also even heard that Philadelphia, you could come to Philadelphia and buy the best heroin in Philly. So you have other people that are coming from different states or different areas or different cities that don't come to Philadelphia to visit Philadelphia. They come to Philadelphia to do this illegal drug. My question would be, are we sending a message? Are we sending the wrong thing, that you can come to Philly, buy illegal drugs from a drug dealer, and then go to this site and do it safely, so that that person can inject themselves and make sure that he doesn't overdose, and then to go back out in the street to do that cycle all over again? I don't know if that's a good way of doing that. I mean, that's just me personally. I think the drug trafficking that's coming in Philadelphia, when somebody can turn around and say, come to Philly, you can get the best drugs, and now you could do it safely. Now you don't have to worry about getting locked up or whatever the case may be. My question, I guess, would be is, if you stop the drug that's coming into the city, if law enforcement will get more involved and get these illegal drug dealers out of the streets and place that more in Philadelphia, because I truly believe that there's a lot of drug trafficking that's going on in Philadelphia.
Mm-hmm.
So I think that's the problem first. And then you got to understand, a drug person who wants to do drugs does not care about life. They know that they're injecting the stuff, and they don't have a fear of whether they live or die. Because, as we can all tell, every year it's getting higher and higher and higher. So, my question would be, are we enabling people to come to Philadelphia and say, hey, look, now we got safe injection sites. We could come to Philly, buy the best drugs, and then go to this site and do it, and don't have no ramification according to the law about what they're doing.
So that's a great question, and I want to try to hit all the points. So you're saying, you're asking, what messages are we sending to people? Should we not do more with law enforcement to stem this problem instead? And the people who are using these drugs know what they're getting into, I think, are the three major things that I'm hearing. So the first thing I want to say is that, like, the mixed emotions, of course, right? Like, of course, there's mixed emotions when you see the situation under the bridges is hard to watch. And if that's your community, if those are your people, if that's your school across the street, if those are your kids walking over, trying to get to the park or whatever, yes, of course, you are going to have mixed feelings, and those feelings are 100% legitimate. There's nothing I can say to ever discount that, right? It's hard, it's frustrating, and it feels like a conflict, right? Like, you have these mixed emotions. That makes perfect sense. What I will say, though, is in terms of, like, what is the message that we're sending? The message that we're sending, in my opinion, is that we care more about people's lives and, like, the suffering of our citizens who are sick and trapped in a sickness, more than we care about punishing people. Because when you talk about, like, shouldn't we put more effort in the criminal justice system? Shouldn't we put more effort into law enforcement and all of this stuff? Yeah, but we've been trying that for 40 years. Right? The war on drugs has been going on since the 60s, and all we've been doing is amping it up and amping it up and amping it up. More money, more paramilitary, more all of this violence, all of this policing, all of this stuff. And all we've seen is in the last, like, Since 1999, drug overdose deaths have increased almost 5% almost every single year. It dipped down for a little bit in the early 2000s and then it went up again. All we see is more people dying. All we see is more violence as a result of the war on drugs. All we see is more communities getting ripped apart, more family members getting ripped apart because they're going into, they're getting incarcerated, and that incarceration is affecting communities of color 9 times more than white communities. It's affecting Latino and Black Kensington people more than it's affecting Rittenhouse, even though those two communities use drugs at the same exact rate. So like when you're saying, like I understand the instinct to say like, why don't we just police our way out of this more? But we've been doing that for 40 years and it's not working, it's getting worse. The crack epidemic was one thing, the HIV epidemic is one thing. We've passed that. At the height of AIDS, HIV epidemic, we were at 800 deaths. Now we're at thousands. Like it's not working. And at some point we have to like say like, okay, my instinct is to punish and to say like, we're gonna make this illegal, we're gonna make it harder, we're gonna do more law enforcement, we're gonna lock up these drug dealers. But at some point after 4 decades, like look at the evidence and see like it's not working, it's getting worse. We're not getting the results that we want. And not only that, we're tearing apart families and we're recreating trauma in our communities. So when you ask me like, what are the mixed messages that we're sending to people? What I think what we're saying to people, the messages that we're sending is like, listen, we tried it. We tried the law enforcement thing. It's not working. All we're doing is shooting ourselves in the foot. And at some point we have to decide, we have to make the statement that we care more about people's lives and living and giving them a chance to get into recovery than we care about continuously slamming our head against a wall and slamming our head against like other people's head against the wall. Because at the end of the day, substance use disorder is a disease. It is. And like the people who I see every day, I'm out there every day and it's hard and it's frustrating. I get a lot of stuff where I feel very, very conflicted about what I'm seeing, but every day someone asks me to go into detox. Every day someone tells me, I don't want to live like this. Every day someone tells me, can you figure out how to get me into housing? And I have to call like 7,000 different people to try to figure out, how do I get you in with your insurance, with your issue, with this thing, or whatever. Every single day, I see women.
Talk about the resources as well.
Yeah, no problem.
That we will definitely, what resources are available for the user, the addict, the people that are using these safe injections.
Definitely. One other thing though, I want to make an analogy that I think is really important for people is that type 2 diabetes, right? Type 2 diabetes is something that you get because you ate too much sugar and too much fat your whole life, right? Type 1 diabetes you're born with. Type 2 diabetes because you ate a crappy diet for most of your life and now you have insulin intolerance and you now have type 2 diabetes. So now you come into my office and I could say to you, you made bad choices your whole life, right? I could say to you, you ate poorly your whole life, like you did this, right? Sorry. But like if you told me that you ate a hamburger or you had ice cream, I'm not gonna not give you your medicine because you made this mistake. I'm not gonna not give you your medicine because you have a sickness and you made a lifestyle choice that made that happen. My job as a healthcare provider is to make sure you're healthy and happy, and that's it, regardless of your lifestyle choices. It's not my job to shame you, and I'm certainly not gonna take away your medication because of that.
So 2 things. One is that, I think, as has been indicated, the idea around mixed emotion certainly makes a lot of sense. I do think that at the end of the day, though, that people are not making the decision consciously to harm themselves. That I want to underscore the idea that substance use disorder, that addictions is a disease, and that I think those folks, all of those folks, deserve absolutely the right to be able to access treatment, and that's what we really want to be able to do. I think the piece around, it's also important to understand that, fundamentally, if somebody is selling drugs, the police will continue to do their job, right? They will, that is not changing at all. What we're talking about here is that when an individual who, you think about, you're talking about the community. I was over at the storefront on Kensington just yesterday, right? So I completely understand where you're coming from. I think that but what we're talking about is when those folks that were walking into that storefront, some of those folks were, at that point, they were actively using, right? But they walked into that storefront, and when they walked in, they were engaged. They had an opportunity to sit down. They had an opportunity to get a warm meal. They had an opportunity to be able to get something to drink. Then they had an opportunity to have somebody say, because there were 2, goes to your question around kind of resources. There were certified recovery specialists that were at the storefront. This is a mural art partnership with the Department of Behavioral Health and Mural Arts. And so they were able to, engage those individuals and say, so, if you want to consider treatment, to start talking to them about Prevention Point, which is down the street. So I think that, there really are, this is really more of looking at opportunities to engage people, because I would really push back about the idea that people are saying, I'm injecting and I want to kill myself. I would say actually the message is very different. The message is saying I'm injecting and I'm reaching out for help. And so if there's a way that you can get me to help in a way that I can receive it, I will accept that, and then we will be able to move towards treatment. So I want to really say that is really, at the end of the day, we really are about getting folks connected to treatment as much as possible.
Absolutely. Like It Is will be right back. We're back with Like It Is. So we wanted to touch back on the legal ramifications of it. Now we know that the DEA actually says that the safe injection sites are subject to legal action. So what are the legal ramifications? How are we protecting the people that are using at these sites and the site itself?
Yeah. So again, I think that ultimately the decision really is about moving this strategy forward, because we believe it's going to result in lives saved and then people connected with treatment, which is at the end of the day kind of the most critical. There are certainly a number of legal questions that I think that are being asked that will have to be resolved in terms of both from the medical professionals that are going to be at the site themselves, as well as just kind of how the site itself is operated. What will continue to happen, though, is that people who are selling drugs will continue to be prosecuted through the justice system. What we're talking about, though, is those folks who are using drugs. Clearly, again, as a result of disease, we want to get those folks connected to treatment.
Is that not a double standard?
So I think it's this. I think it actually is a standard that moves folks towards regaining their health, and that I think that's actually the most important standard.
Okay. So we talked about the healthcare professionals that will be working in these sites. So what are precautions that are being taken to prevent the overdose, and what's the plan to provide adequate care to those that might be overdosing, and what happens after?
You mean on the site?
At the site.
So the way we could have wanted to talk a little bit about this before, like the way you flow through a safe consumption site, when you go in, you're given like sterile equipment, you're given a sterile syringe, you're given all of this type of stuff, and then you go into like a stall, and it kind of has like a mirror on the back, and then there's a sharps container and that sort of thing. So what happens is, first of all, you're getting sterile equipment, which means you're reducing the amount of new transmission of things like HIV, Hep C, that sort of thing, which is incredibly cost effective. And then the second thing is that you have like a nurse or someone who is trained in opioid reversal kind of just walking back and forth and just like observing, and that they can see in the mirror as someone is using like the signs of an overdose. So that would be like someone's breath kind of getting very low, lips turning blue, kind of, turning very pale, and that sort of thing. And they would look for those signs. And if someone was overdosing, they'd kind of maybe shake them and check. And if not, and if yes, you just get some naloxone. And like I said, addiction is very difficult. Opioid reversal, overdose reversal is not. You give someone some naloxone and it's kind of magic. So.
Okay.
Right. And the only thing I will add to that too is that, the department more broadly actually has been providing training in Narcan administration. We're continuing to provide those trainings. It's really available, and we're trying to make sure it's available far and wide. Those Narcan, that Narcan administration has been happening. It's happening in Kensington. Is actually happening across Philadelphia. And as Christina has pointed to, that's also, again, the strategy that's been used inside the supervised injection sites internationally.
Another question from the audience. State your name and where you're from, sir.
My name is Tom Beck, and I am from Philadelphia. My question is about the supply of the drugs. Earlier in the show, it was said that the users would be supplying their own drugs to the safe injection sites, and the safe injection sites or the queues wouldn't actually be supplying them. My question is essentially, why not supply them? Wouldn't it be safer if people were injecting themselves with heroin that they knew was heroin and not heroin laced with something stronger like fentanyl?
Great question.
Yes, it would be safer. You are right. I mean, that's the reality, is that yes, something that a substance that is regulated is inherently going to be safer than a substance that is regulated by the black market. There are countries like Portugal, for example, where they have medical heroin, and you can go to a clinic and you can get heroin that has been prescribed to you by a doctor, and you use it, and you're kind of tracked the same way that we track Vicodin and people who are using prescription opioids, which essentially is not that much different from heroin. Like, you get heroin on the street, you get morphine in the hospital. They're essentially more or less the same thing, and one is regulated and one is not. And when you're in a hospital, you get morphine that's morphine, and then when you're in the street, you get heroin that you don't know what's in it, and that is dangerous. That makes it dangerous, for sure.
And we have another question from our audience.
My name is John Taylor, and I'm from West Philly. And my question would be, I'm all for helping people with opiate addictions and providing these sites. And I'm aware of places like Act 2 who are helping people with certain addictions and stuff. But my thing is, who will be solely responsible for the finances of all these clinics that would just help people with these type of addictions? If that would be a taxpayer thing or a medical thing or state funded, government, federal funded, how would that work?
Right, so funding right now is going to be private. That being said, I do believe, like syringe exchanges, like Prevention Point Philadelphia right now is, I think, 80% funded by the government. Like, it gets 80% of something like that of its money from Philadelphia. So will those things change over time as the evidence builds up? Probably, but I don't know. Currently that's where it's at.
All right, and sir, our next question. And our final question, state your name and where you're from.
My name is Deborah Kelly. I live right outside of Philadelphia. I'm glad to hear that you're going to have emotional support for individuals who have decided to self-medicate. But I'm wondering, after they are, helped through the process to understand why they decided to take drugs and they're now off of drugs, what support will you supply for them when they have to go back into the community with the same people and same friends and same environment?
Absolutely. Drug consumption part is one part of like all of these different services that are happening. It's the part that we talk about the most because it's the part that's like illegal.
The most controversial.
Right, it's the part that's the most controversial, but that's not all that's going on there. Inside in Vancouver, it has the injection site, it has a clinic next to it, so if you need healthcare services, you go right to the clinic, and there's all these doctors and nurses. On the second floor, they have detox there, and on the third floor, they have inpatient, so you can live there and go into inpatient detox. Like, all of these services are in this building. It's really amazing. So like, we get caught up on this idea that, oh, it's a site for injecting drugs, but it's not. That's one piece of a huge like wraparound
It's more of like a
clinic.
That is
But not just a clinic. Like, a clinic is just for medicine. This is a clinic in housing and mental health care and detox and all of these different things, and that's what makes it so amazing.
For all those things.
Yeah.
Awesome. So, final words from our guest.
So we certainly appreciate the opportunity to come out and talk about comprehensive user engagement sites. As we had indicated that this is one of many strategies that we feel will help turn the tide on the opioid epidemic, and we look forward to continuing to work with the community.
Thank you so much for being here. All right. And then Christina too.
Oh, okay. Thank you so much for having me here, and thank you so much for all of the questions that you've had. If anybody is interested in learning more about queues and safe consumption sites in general, you're more than welcome to contact Soul Collective. We love to come out and talk to people. We love to do town halls and panels and education, and then we also do outreach. So if anybody's ever interested in volunteering and really seeing more about what harm reduction looks like in practice, you're more than welcome to contact Soul Collective, and we'd be happy to hear from you.
Well, that is the end of a very informative show. I'd like to thank our guest, David Jones, as well as Christina Garces. Thank you so much for being here today.
Thank you for having us.
You're welcome. Whether safe injection sites are a means to an end for addicts remains to be seen. They may allow an addict to feel safe during their drugs, but that alone will not fix the city's opioid problem. The only way to do that is through treatment, support, counseling, and abstinence. Like It Is can be seen every Saturday at 5 p.m. on Comcast Channel 66 and 966 and Verizon Channels 29 and 30. To watch previous episodes, go to the Like It Is YouTube channel. And now, from the entire Like It Is crew, our guests, and the studio audience, thank you and have a good day.